Dr. Dawn Kuntz, and you're watching Paying for Psychological Services. This video was created to help you understand the various payment options you may want to consider when taking your child to see a psychologist. This video will discuss the pros and cons of using insurance versus paying privately for psychological services, medical versus mental health coverage, and in-network versus out-of-network insurance benefits. If you have made the decision to take your child to see a psychologist, your next decision will be whether to use your insurance benefits or to pay privately. Some psychologists have chosen not to partner with insurance companies because of privacy issues and limitations that insurance companies place on them. Families should be aware that psychologists are required to submit a diagnosis to insurance companies in order to receive payment for services. There is also a concern that insurance companies may not keep sensitive mental health issues private, and families may not be fully aware of who might have access to their personal information, especially during clinical reviews or audits. Paying privately allows complete confidentiality from your insurance company. Additionally, insurance companies often dictate how long patients can be seen and what type of treatment providers can implement, frequently without any substantial clinical information about the patient. Many insurance plans require pre-authorization for treatment. This means that you must call and tell the insurance company why you are seeking treatment before you see the psychologist. The insurance company then determines how many visits you are allowed, and the provider must send treatment updates when they request additional visits. These updates contain sensitive family information. At times, insurance companies may even refuse to authorize additional sessions, leaving the patient having only received partial treatment. Due to all these limitations, many psychologists elect not to participate with some or all insurance plans because they don't want to be under the arbitrary rules of companies that don't even know their patients. If you are interested in the private pay option because of these insurance caveats or simply to protect your confidentiality, please discuss this with your psychologist when you schedule your initial visit. One issue that is often confusing to those who are seeking mental health treatment for the first time is that in some cases your mental health coverage is provided by a different insurance carrier than your medical coverage. In other words, the insurance card in your wallet says one thing, but when you call to determine your benefits, you find that you have to call another insurance company for authorization. If you look at the back of your medical insurance card and it says, "For mental health and substance abuse, call," and then gives a phone number, it is likely that you have a different insurance company covering your mental health benefits. If your card doesn't say anything about mental health on the back, then you probably have the same insurance company covering both your medical and mental health benefits. If you decide to use your insurance benefits, your next decision is whether you will be using someone who is in-network or out-of-network with your insurance carrier. In-network means that a provider has a contract with your insurance company, and the provider, or psychologist in this case, has agreed to take a predetermined reimbursement amount from the insurance company for services provided. With most insurance plans, the family usually has a co-payment, so check your mental health benefits for this information. To obtain mental health benefit coverage, look on the back of your insurance card and call the number for member benefits, or if your card says "for mental health call" and then gives a phone number, call that one. Sometimes the amount of the co-payment is actually listed on the front of your insurance card. Occasionally there will be several different co-payment amounts listed on the front of the card, depending on whether the visit is to a primary care physician, a specialist, or an emergency room. Child psychologists are usually considered specialists in that type of co-payment system. If you have called to check on your mental health benefits, You will also want to find out if you have a deductible to satisfy before your insurance will pay for the psychologist's services. If you have a deductible that hasn't been met yet, you will be required to pay the psychologist the rate that has been contracted with the insurance company until the deductible is met. Once the deductible is met, you will just be responsible for paying your copayment at each visit. Some insurance companies don't have a copayment per se, but rather a co-insurance, which is actually a percentage of the contracted rate that the patient is required to pay, rather than a flat fee. It is important to mention that even if your psychologist is considered to be in-network with your insurance company, some psychological testing is not covered by insurance at all. You may be able to use insurance for part of your clinical evaluation, but the testing itself may not actually be covered. If you would like to see a psychologist who is not in network with your insurance, you first need to see if your insurance plan has out-of-network benefits, which means that your insurance company will cover a percentage of your visit. There is usually a deductible that you will have to satisfy before the insurance will begin paying for part of the sessions. That means that you will have to pay the psychologist the full fee each session until the deductible is met. After the deductible is met, the insurance company will pay for a percentage of each session fee, and the patient's family will be responsible for the remainder of the fee. When a patient is required to pay a percentage of the session fee, this is called a co-insurance rather than a copayment, which is a flat fee. The most important thing to do is to familiarize yourself with your insurance benefits before you actually seek treatment for your child so that you will know your share of the cost. Once you have determined your benefits and financial responsibility, ask the psychologist you have chosen to give you the fee schedule for each type of session. The initial session and follow-up sessions will usually vary in price. Additionally, other psychological services such as testing, school visits, home visits, consultation, family sessions, and individual sessions may vary in price. Finally, ask your psychologist if he or she files claims with your insurance company. Some psychologists opt not to file with insurance and instead give their patients statements or an already completed claim form to submit to their insurance company. In these cases, the patient pays in full for the service up front, and then they are reimbursed by their insurance company. In summary, here are some questions you can ask when you find a psychologist. 1. Is the provider in network with your insurance company? 2. If they aren't, and you have out-of-network benefits, can the psychologist file your claim with your insurance company? 3. What are the fees associated with their psychological services? 4. If you prefer to pay privately because of privacy issues, what forms of payment does the psychologist accept? 5. Call your insurance company and obtain mental health benefits including copay, co-insurance, deductible, number of visits allowed, and whether your plan requires pre-authorization. If you need pre-authorization, you should obtain an authorization number, effective dates, and number of visits. It is important for you to take this information with you to your first appointment. Thank you for watching today. We hope you found the information provided in this video to be helpful in understanding your payment options for psychological services. As parents ourselves, we know how important it is for you to make informed decisions about your child's health and well-being.